what I thought I'd do is give you an overview of antimicrobial use in poultry production, including the so-called growth promoters. Basically, we have in feed, we were just talking about subtherapeutic use. I know it's a very negative term, but it has actually made perfect sense to me, because we're not using therapeutic levels because we're not treating a clinical outbreak of disease. We're using subtherapeutic levels because we're preventing subclinical disease. And believe me, the Denmark experience proves that unquestionably. So at low levels in feed to prevent subclinical disease, maintain enteric health. And that's what is the so-called growth promoter use. I did not pick the term. A much more accurate and descriptive term would have been health promoter. That's what these products are. At higher levels in feed, or by other means, they're considered therapeutic levels when they are used to control or treat diseases like necrotic enteritis, for example, in chickens, or systemic E. coli infections. Sometimes they're injected. We have, in fact, one of the prohibitions that Dr. Hong was talking about earlier today. In novo use of cephalosporins is what triggered the prohibition on ELD uses of cephalosporins. The product is being used extra label because when it was developed, we didn't have in novo injecting machines for vaccinating chickens for Marek's disease. Everything was hand done by subcutaneous injection, and that's why the approval was done that way. Years later, the machine took over. The industry had widely adopted it, and that's why it's been administered extra label by in novo injection. At certain times, they're injected in valuable birds, particularly breeder birds, whether it's broiler breeders or turkey breeders, to treat serious diseases such as fowl cholera or other conditions resulting in things like erysipelas and high mortality of very valuable birds. And of course, in drinking water, which is the preferred mass method of administration, usually to control or treat bacterial infections like chronic respiratory disease, CRD, or fowl cholera. Now, the industry has taken notice, and there has been changes, and some are published and documented, like this review by Chapman and Johnson, published in Poultry Science, 2002. The green bars represent the levels of antimicrobials used in starter feed in broiler chickens in 2002. In 1995, the green, and in 2002, the blue. So as you can see, there's been a significant drop in the usage of antimicrobials in starter feeds, grower feeds, as well as withdrawal feeds. So the industry is taking notice, and it's been responsive to concerns about use of antibiotics, antimicrobials in feed. However, they remain an important tool that poultry producers have at their disposal to ensure or maintain good enteric health. And this is the bird is maintained healthy and ensure that only healthy birds enter the food chain. As was mentioned here earlier, the European Union bans of antimicrobial growth promoters, or AGPs, that culminated in 2006 with the final three, has resulted in a deterioration and increased usage of therapeutic antimicrobials, as I will show on the next graph, which is the DanMap data. And as you can see, since even it was lower even here in 96. But if we start with 98 with the final practical prohibitions, the final ones were removed in 2000, I believe. But for all practical purposes, all growth promotion uses ended in 98 with the ban of bacitracin, virginiamycin, tylosin, and spiromycin. And as you can see, there's been an unquestionable increase in therapeutic use. And by the way, I have figured these out by milligrams per kilogram of meat produced, and it doesn't make any difference. It follows exactly the same trend. So the usage didn't increase because they doubled their food animal population. The food animal population has stayed the same or has decreased, while usage has increased. This was mentioned earlier before by Dr. Huang, I believe. As these issues became relevant in our practice, the different specialty groups developed their own judicious use practices for use of antimicrobials. The poultry veterinarians did ours in a joint project with AVMA, AAAP, the American Association of Avian Pathologists, as well as FDA CVM. And these have been around for longer than a decade, like she mentioned. Now, uses of antimicrobials for therapeutic purposes have also declined, and some of the reasons are, and this is one that probably, I don't know how many people think of these, but I've been practicing in this country long enough to where I've seen the conversion to nipple drinkers, okay? That was amazing. I mean, I can think of a few breakthroughs in poultry health, such as the development of Marek's disease vaccination, before and after Marek's. Well, you can say before and after nipple drinkers, because I guarantee you that the sales of therapeutic antibiotics sank completely when we went to enclosed watering systems instead of open type systems that allow dust contamination. So that was a major breakthrough, and that has been around. They've been around probably 2 decades now. Implementation of judicious use principles, like I mentioned before, and just improvements in overall management of poultry that have resulted in improved health, such as tunnel ventilated houses that keep us from having these birds stressed during the summer, where they start ingesting large amounts of dust and are predisposed to hersiculitis, bacterial infections of that type. The implementation of best management practices, which have been guided by both NCC and NTF, the National Chicken Council and the National Turkey Federation, have been key, as well as new vaccines that have been developed that are more effective, better vaccination methods, like the Innovo system that I mentioned, and improved vaccination programs. So all of that has contributed to less antibiotic usage in poultry. Other things that have contributed, we have better biosecurity practices. For those of you that were at the poultry session this morning and were shocked by the conditions of biosecurity in Southeast Asia, that was a good experience. We have a shorter production cycle as well because of the improvements in genetics that allow the birds to reach the same market weight in much less time. So, you know, we're processing birds at 5 weeks at times now. There's not time for a chicken to get sick hardly in 5 weeks versus 16 weeks like it used to be. There is increased production of drug-free and or antibiotic-free poultry, and this comes strictly, this is consumer-driven or, you know, market-driven. So if they're willing to pay the price, companies are willing to produce them. So that has contributed some. Other issues are concerned about residues for export and restrictions imposed by trading partners, you know, like Russia all of a sudden came up and said they were going to set a 1 part per trillion limit on nicarbazine, which was absurd because I'm sure they can't measure it. So anyway, but they say it and companies comply with it. Okay, I told this gentleman here that I was going to show him some myths and facts about antimicrobial use in poultry. One of them is, the myth is that they're used in feed to promote growth, okay? And animately oppose that view. Antimicrobials in feed, even when used at levels labeled for growth promotion, are used to prevent subclinical disease, to prevent immunologic stress, and to improve enteric health, flock uniformity, and ultimately the safety of the food supply. And if anybody wants scientific references documenting each and every one of these points, I'll be glad to supply them to you. Second myth, antimicrobials are used as crutches to raise poultry in unsanitary environments and poor management conditions. Nothing could be farther from the truth. Poultry companies strive to raise flocks under optimal environmental and management conditions, as these leads to good performance and profitability. Sick flocks do not generate profits. That's why the tunnel ventilated houses, that's why the nipple drinkers, that's why the Innovo vaccination for Marek's. So this thing about that the active is used against us is complete nonsense. Another myth, our meat supply is tainted with antimicrobial residues. I couldn't tell you how many times I've read nonsense like these in the Boston Globe and garbage like that, where someone tells you the food is laden with, these antibiotic hamburgers and all this stuff I've heard. Nothing could be farther from the truth. That meat supply is closely monitored by the USDA FSIS service to ensure compliance with permitted residue levels. Another myth, poultry producers can administer antibiotics purchased over the counter. This is not true. Even though they may be available over the counter, as was discussed earlier, all poultry companies' contracts strictly prohibit use of any antimicrobial agent by contract growers, so no one can do that. Another myth is that antimicrobial use in food-producing animals is the main cause of antibiotic resistance in human medicine. The reality is this study by Robin Bywater and Mark Casewell, published in 2000 in the Journal of Antimicrobial Chemotherapy, shows that the estimated contribution of antibiotic use in food-producing animals to antimicrobial resistance in human ranges from 0.5 to 1%, depending on the pathogen involved and the antibiotic involved. Certainly there is a risk, but the risk is not nearly as great as they want to make us believe. Use of antimicrobials for growth promotion is increasing. As I showed you, it is decreasing. ELD use by veterinarians is permitted in feeds for food-producing animals. I tell you, I would show that clearly that is not the case. All antimicrobials are approved for ELD use. Certainly there are quite a few exceptions to the rule. New antimicrobial drugs for treatment of food producing can be purchased without a veterinary prescription. Since 1998, no antimicrobial that has been approved for animal use, for food and animal use, is approved without a prescription. So in conclusion, antimicrobials are important tools to the poultry producer to prevent disease, maintain enteric health, as well as to treat disease, mitigate pain and suffering, and enhance the welfare and quality of flocks raised in confinement. Poultry industry is vertically integrated, controlling all aspects of the production cycle from breeders to processing plants. As such, poultry companies own the birds and contract individual growers for raising the birds under strict guidelines and standards of care or best management practices set by the poultry companies. Most companies have their own staff, veterinarians specialized in poultry medicine, to oversee the health of all birds raised by the growers contracted by the company. And the few that don't have them use allied industry veterinarians like myself or veterinary extension department veterinarians to help them with their antibiotic use decisions. Poultry producers are strictly prohibited from using antimicrobials in their flocks without the company's prior knowledge and approval. And antimicrobials are only used when the veterinarian deems it necessary. And usage records indicate that the poultry industry is using antimicrobials in a responsible manner to protect both poultry and human health. And with that,